Welcome, everyone, to another episode of Dr. America. I am your host, Dr. Sanjeev Sriram. Here we are on the We Act Radio Network. And for this week's episode, I want to take you guys back to when we took the show on the road to the Supreme Court and the hearings on King versus Burwell. This was the latest threat to the Affordable Care Act, and we got to meet a lot of fascinating people, some really remarkable advocates, people who really know their stuff about the Affordable Care Act. So to share more about their expertise and in honor of National Women's History Month, I'm really excited to introduce the next two interviews that we have for you. We have Ms. Lauren Kennedy from the National Partnership of Women and Families, and then we have Ms. Karen Davenport from the National Women's Law Center. Both of these women have given fantastic interviews sharing what's so important about the Affordable Care Act to women, to families, to children, and what we can do about it to make sure that the Affordable Care Act is living up to its potential for all of our fellow Americans. So here we go with our first interviews, Ms. Lauren Kennedy and Ms. Karen Davenport.
Today, the Supreme Court is hearing arguments for King versus Burwell, the most recent in a long line of threats to the Affordable Care Act. And with us today, we have Ms. Lauren Kennedy from the National Partnership for Women and Families. She's the Director of Health Policy at the partnership, and she directs their health policy portfolio, oversees advocacy strategy for key policy priorities, including the Affordable Care Act, the health delivery system transformation, and comprehensive patient payment reform. We're thrilled to have Ms. Kennedy on the show, and welcome for joining. Thank you for joining us.
Thanks for having me.
All right. So Lauren, I was wondering if you could kind of, we're getting close to the Affordable Care Act's 5th birthday. It's going to be turning 5 later this month. And, before we get into the details of King versus Burwell, do you mind just sort of giving us sort of the highlights of what the Affordable Care Act has meant to women and families since it was signed in 2010?
Would be happy to. The Affordable Care Act has really been the greatest advance for women's health in a generation. Hands down, it's been a game changer with respect to making comprehensive health coverage affordable for millions of women and family, and it's really changed women's ability to access the services that are essential to their health. So under the Affordable Care Act, we now have maternity care that is required to be covered by plans in the marketplace. This is an essential health benefit. And we have enhanced access to preventive services like family planning, breast cancer screening, cervical cancer screening, preventive services that have to be covered with no cost. So really making sure that women are able to access the services that are critical to their health and well-being and in an affordable manner.
So, it sounds like we went a long time without these very common sense provisions in our healthcare system. The things that you're describing, like breast cancer screening, maternity care, these should have been common sense things that our insurance plans should have just been providing at, like you were saying, no cost, so that women wouldn't be financially restricted from getting these accesses to care. And now finally, thanks to the Affordable Care Act, we've got all of this. And that kind of brings us to today with King versus Burwell, because it seems like a lot of that is on the line now with the Supreme Court case. So how did we get here?
Well, King versus Burwell has been making its way through the courts for a little while now. What's at stake is the question of whether premium tax credits, which is the financial help that helps lower and middle income people purchase health coverage through the new marketplaces that were set up through the ACA. What's at issue is whether tax credits can be made available to individuals who enroll through the federally facilitated marketplace. So most people know that as healthcare.gov. Mm-hmm. And healthcare.gov is acting as the marketplace for over 30 states, somewhere between 34 and 37, sort of depending on how states have set up their marketplace with the federal government. And so what this means is if we were to get a bad decision in the case, millions of people who have enrolled in coverage through the federally facilitated marketplace, healthcare.gov, would lose their eligibility for premium financial assistance.
And now they're getting priced out of those health insurance plans, because without those subsidies, it becomes almost impossible for these middle-class families families to afford the plans, right?
Right. So many people would find health insurance, once again, unaffordable. These premium tax credits for many people are covering up to as much as 75% of their monthly premium cost. So it's a huge difference in terms of cost. And for a population that sort of heretofore has found insurance to be financially out of reach. So I think we could expect something like 8 million people to rejoin or join the ranks of the uninsured if we were to see a bad decision in the King case.
Wow. So 8 million people. Now, let's say, you have insurance, and it's through your employer. You don't really, you're not really relying upon these federal exchanges to get your insurance. Are you free and clear and safe from the Supreme Court's decision today, or does this have an impact on your health care too?
If you are receiving your insurance through your employer, you may not feel repercussions for some time. I think where we can expect to see a very immediate impact is anybody who is getting an individual policy through the marketplace. And that's because many people are enrolling in coverage through healthcare.gov without premium subsidies. They're paying for the full cost of their coverage out of pocket. But if we see premium subsidies taken away from people in the federal marketplace, and then those people are priced out of coverage, we can expect that the sort of higher needs, higher cost people who really need coverage because they're sick will do everything they can to keep coverage. But healthier people will probably leave the marketplace, with the end result being that premiums will spike dramatically for everyone.
Okay.
So even if you were not receiving a subsidy, you could still see your premium rise. It's been estimated somewhere between 35 to 47%. So again, a huge jump, because the marketplace itself would have changed dramatically in terms of who's buying coverage and who is in the risk pool with you.
Right. So this is a big deal. I mean, it's there are like these ripple effects. It sounds like it might not impact you immediately in June when the Supreme Court comes back with their ruling, but by the end of the year, you might be feeling it. Okay.
Indeed, I think we can expect it to be pretty chaotic if we see a bad decision.
Okay, so let's look at the flip side of it. Let's say we try to be like optimistic with some rose-colored lenses here. What would be the impact if the Supreme Court disagrees with the plaintiffs and sides with Burwell?
So in that case, it would be sort of agreed upon that the premium tax credits are available to everyone through the state-based exchanges, through the federally facilitated marketplace. That is the intention of the Affordable Care Act.
Right.
So many of us would argue that is that the very
so
clear
we're living
decision
up to the mission of the law
here. Yes. So you would sort of maintain that stability, and what we hope as healthcare advocates is that would free up Congress to finally think about what are some of the ways that we can improve upon various aspects of the Affordable Care Act. We know the Affordable Care Act is working, but there are different provisions in the law or sort of ancillary programs related to the law that we would love to see built upon and improved to continue to make sure that everyone is able to access affordable, high-quality healthcare services.
Okay, well, thank you, Lauren Kennedy, for joining us from the National Partnership for Women's and Families. We'll definitely be sending our listeners your way and to your organization's way so they can learn more, get involved. Thank you very much for joining us today.
Thank you.
You're listening to We Act Radio, WPWC 1480 AM. Visit us online at weactradio.com.
Welcome back, everyone. You're listening to the We Act Radio Network here on at Families USA Radio Row. Today, the Supreme Court is hearing arguments about King versus Burwell. This is the latest threat to the Affordable Care Act, and to help us make more sense of it, and in particular what it would mean for American women, we have Ms. Karen Davenport. She is the Director of Health Policy at the National Women's Law Center, and Karen has an amazing track record of doing great policy work with healthcare and health reform in particular. So we're really excited to have her on the show to share with us some insights about the ACA, about King versus Burwell, and where we go from here. So Karen, thank you so much for joining us.
Oh, thanks so much, Najib.
Okay, so we're at about the 5-year birthday of the Affordable Care Act, and so over these last 5 years, from your vantage point, what has the ACA really meant for women and women's health?
Oh, the ACA has been huge. I don't think I could overstate how important it's been. Before the ACA passed, women were charged more for health insurance than men by, from 30 to 85% more for the same coverage. They were denied coverage because they'd had a cesarean section in a previous pregnancy, or because they were victims of domestic violence and had sought treatment for the health conditions that arose from that. The insurance markets didn't work for women. Most often, plans in the individual market didn't even cover maternity care.
Oh, wow.
So, this has been huge for women. And so since the law has been implemented, women's preventive health services are covered. So birth control and mammograms and getting testing for the gene mutations related to breast cancer and all sorts of other important women's health services are covered, and covered without cost sharing also. Now that the exchanges have started and people are getting tax credits, women have been signing up more than men. And the tax credits are so important for women because, as you know, women earn less than men. They have caregiving responsibilities and just have fewer resources to put towards something like health insurance. So it has really been a game changer for women.
Yeah, and so so it sounds like for the Affordable Care Act, we've seen greater equity, or we're building better equity, for women's health.
Right.
But then there's also this affordability aspect of it that makes the equity real, that makes it actual, like a real thing in people's lives.
Absolutely. What we see is that women can now get birth control without having a financial barrier to it. They are able to afford health insurance and can take care of themselves, and therefore help take care of their family in that sense as well. And health plans can't discriminate against women any longer, and that is just so important. And as the Affordable Care Act keeps moving forward, I expect that we will see more women covered through these marketplaces and the ultimate good outcomes for women's health.
Yeah. So it sounds like that these that the tax subsidies that are coming to the federal exchanges when women are buying health insurance, that those tax subsidies are actually a significant part of overcoming some of these financial restraints, or at least when it comes to the financial restraints of affording health insurance.
Absolutely. Women went without health insurance because they couldn't afford it. That was even more true for women of color. And of the 7 million women that we estimate are eligible for these tax credits in the states that are at issue in this Supreme Court case, about half of them are women of color.
Wow.
So it is a really important issue, particularly for low-income women, particularly for women of color. And without that kind of help, these are women who won't be able to have health insurance.
And so let's say that the Supreme Court rules in favor of the plaintiffs, and and we start seeing that that the federal government is being told, okay, those tax subsidies that were going to the federal exchanges before, our families and patients can't they can't qualify for that anymore.
Right.
What's the fallout? Both for the women immediately, and then kind of the ripple effects that seem to come from that decision.
So the immediate fallout will be that those tax credits will end, and women will have to decide, can they in any way continue their health insurance, or do they have to go without health coverage? If they go without health coverage, they probably will get what's called a hardship exemption, so they won't need to worry about the individual mandate, but they'll still be uninsured.
Okay.
For some women who might be pregnant right now, who may be going through cancer treatment or have an ongoing, chronic illness or a, ongoing problem with pain or something like that, they're going to, be really anxious.
Sure.
We talked to, a number of women, and we profiled them in a brief to the court who are in the middle of treatment now, and this would be a devastating blow to them. So those are the, sort of short-term disasters that we would see. In the longer term, one of the things that we're really concerned about is, the Affordable Care Act was built with interlocking pieces, and one of those pieces is affordability, and one of those is the insurance reforms that make coverage accessible.
Right.
And so the pre-existing conditions exclusions and the waiting periods and the other pieces charging women more, we're really concerned that there will be pressure on those reforms as well, and eventually the whole thing falls apart.
Right.
And in fact, you can see right now that as Republicans in Congress are coming up with their ideas of what they would do, that many of them are mentioning that what they're calling the law's mandates would need to go away as well. And what they call mandates, we consider to be really important protections for women.
Right. So, it sounds like, none of the backup plans that are being, discussed or, strategized are really going to do the same quality job that the Affordable Care Act has been doing these last 5 years.
That's absolutely right. I guess I'd say our, plan A and B and C is that the law is upheld,
right.
and after that, it is really hard to see how we could get back to the kind of success we've had with the Affordable Care Act.
Right, because it sounded like, gender equity in health was it's still kind of a work in progress, but
right.
At least we've got these last 5 years that we've done so far.
Yes.
Okay.
Yes.
Well, thank you so much for joining us today. This was really helpful to help us understand so much about, gender equity, about the quality of our health and what's all at stake with King versus Burwell. Thank you so much for joining us.
My pleasure. Thank you, Sanjeev.
All right. So you guys have been listening to the We Act Radio Network here at Families USA Radio Row, and we'll be right back.
You're listening to We Act Radio, WPWC 1480 AM. Visit us online at weactradio.com.
Welcome back, everyone, to another episode of Dr. America here on the We Act Radio Network. I am your host, Dr. Sanjeev Sriram, and we've been revisiting the King versus Burwell arguments at the Supreme Court. While we were there, we got to hear from Senator Ben Cardin of Maryland. It was a really good interview. He had a lot of insights about how the Affordable Care Act has been of help, not only to Marylanders, but to Americans across the country. It was our privilege to speak with the good senator. And here we go.
Welcome back, everybody. You've been listening to the We Act Radio Network. We are here at Families USA Radio Row. I'm very excited, very thrilled to introduce our next guest. Senator Cardin is here to talk to us about what is at stake with King versus Burwell, the latest threat to the Affordable Care Act. It's being heard right now. Arguments are being heard right now at the Supreme Court. And we are very excited to have the senator with us today from the great state of Maryland. Senator, thank you so much for joining us.
Oh, it's a pleasure to be with you. The Affordable Care Act and those who've been able to get affordable coverage, we've seen the results around the country. Millions of Americans have benefited. Many in my state of Maryland have now affordable health care coverage. The clear intent of the law passed by Congress was that those who enter exchanges would be entitled to the affordability issue, the credits that are available. That's the clear ruling, whether it's a state exchange or one established under the federal government because the states have deferred to the federal government. So the clear reading of the statute is to continue those benefits. Any other reading would be an activist court trying to change the law passed by Congress. So this is a very important hearing that the Supreme Court is having, and we hope that they'll exercise the proper role of the courts and allow the legislature to enact the laws.
Right. And, I think that, it's interesting that you're bringing up the intent of Congress because, after all, I think that a lot of political capital, a lot of time was spent, trying to get this act passed. And for people to be questioning what was the intentions of senators such as yourself or, the members of the House, I think is really interesting. So let's say that, that the court does find in favor of the plaintiffs. Is there any kind of backup plan that we can hope for?
Well, again, that would be totally illogical. What you're saying then is that people who are eligible to get insurance through the exchanges, and we made a commitment, it would be affordable. They have requirements to get that. We no longer have affordable coverage. Many could not afford the insurance coverage without the credits that are available. So there really is not a backup plan. The backup plan was what the Congress passed. Mm-hmm. And if the court for some reason decides it's going to legislate, I think it's going to have to come up with a backup plan.
Okay. And so, let's say that the court actually does, rule in favor of the Affordable Care Act and we are able to keep these tax subsidies coming to the federal exchanges. Where do you feel are the next challenges for either the Affordable Care Act or for our healthcare policies?
It's interesting. You look at the results. You look at the fact that more people have health insurance than ever before. You look at the fact that we now have brought down the growth rate of healthcare costs, the lowest increase in healthcare costs since we've been keeping these records. You look at people now who have quality coverage. Mm-hmm. Some had insurance but didn't have quality coverage. Now have quality coverage. The next step is to build on it. Mm-hmm. Let's stop this debate as to whether the Affordable Care Act works or not. There's no question that millions of Americans will tell you that. Ask seniors who now have better coverage under Medicare. Ask those who are now enrolled in the Medicaid program with the expansion of the Medicaid program. Ask families who have their children on their health insurance policies to age 26 who couldn't do that before, or women who no longer are pre-existing condition just by being a woman. All of those, and getting value, you're getting rebates when your insurance company charges you more than they should. All that's now the law of the land. Let's build on that. And yes, we can build on it. We want to make sure that we have what we call delivery system reforms, where we have more efficient ways to deal with healthcare needs. I'm involved in an area with mental health services. We want people to be able to get community mental health services in the community without having to go to emergency rooms where your primary care doctor has the resources in the community to help you with mental illness. That's what we need to do. Build on the success, but don't tear this down.
I absolutely agree with you, Senator. And, as a pediatrician in the local D.C., area, what I've appreciated is that Maryland is a state that chose to expand their Medicaid and, cover more, Marylanders, in that process. But Virginia, like our neighbor, right next door, is still, wrestling with this. If there's anything that we could, tell, our, colleagues over on the Virginia side, what would it be about, Medicaid expansion?
Well, Medicaid expansion helps the people of your state. Mm-hmm. It tells the people who otherwise would struggle with the affordability of health care that we are going to be a partner in making sure that they get health care for their families. So it makes no sense to say that you want to penalize the working poor in your state and deny them the ability to get affordable health coverage. And,
I'm glad that you're bringing it up as, penalizing the working poor, because just as you're saying that they're being penalized for no other fault than for the state that they're choosing to, to live in. As a healthcare provider, I kind of also am looking at my colleagues who are working in Virginia and, the struggles that they're going through with their hospitals trying to keep the lights on. And I've heard that in Maryland that, because of the Medicaid expansion and their cooperation with the federal government, they've actually been able to not only, keep those lights on, but actually turn it into job creators for the state.
Oh, absolutely. Access to affordable health coverage is an economic growth issue. One of the things we're struggling with, middle-income families are finding it difficult to keep up with costs. There's been a wage gap in this country. We know that. But one of the issues is affordable health coverage. With health costs going up so high, many people could not afford it. Many businesses were turning people away. Now you have that protection. So yes, it's a partnership between the government and the private sector. The Medicaid expansion allows those that are the most vulnerable to make sure that they have coverage. The Affordable Care Act through the exchanges allows those who otherwise would not have affordable health insurance, who could afford it, but it would be difficult to get a quality product, to get a quality health insurance product that's going to cover their needs, but also an affordable product. So it's a real partnership, and it's the expansion of Medicaid, it's the availability through the exchanges, it's the responsibilities of employers, and it's the improvement of the Medicare program. All have worked together to give much stronger coverage in our community.
And I really appreciate your rundown of the Affordable Care Act as this network of provisions that all kind of are tied together and work together with each other, that one reinforces the other, and that you can't really do what they're doing with King versus Burwell, pick at 6 words, towards the tax subsidies and exchanges, and expect that the rest of the law is going to stay in place.
Right, it would make no sense. I mean, you think about that again. We have people getting insurance through exchanges. That was part of the Affordable Care Act. So they had choice. They could get the plan that meets their needs, that it would be affordable, and that they could make their individual judgments, those who enter the exchanges. We gave the states the first opportunity because this is a federalism. And we know the states are closer to the people. Some states decided to take advantage of that. Others said no. In the law, we have the default to the federal government. It's still an exchange.
Right.
So the benefits are the same. It was meant to be, it clearly was seamless. That's why it makes no sense whatsoever for the Supreme Court to rule other than support what Congress did. If they do anything else, again, it's the Supreme Court legislating their narrow agenda.
Well, thank you so much for joining us, Senator Cardin. I really appreciate your insights, and let's keep our fingers crossed that the Supreme Court, rules in favor of the Affordable Care Act. Thank you so much for joining us.
My pleasure. Good to be with you.
All right. Well, thank you, everybody. You've been listening to the WEAC Radio Network. Here we are at Families USA's Radio Row. Thank you very much for joining us. We'll be right back.
You're listening to WEACT Radio, WPWC 1480 AM. Visit us online at weactradio.com.
Welcome back, everyone. You've been listening to the Dr. America Show here on the WEAC Radio Network. I am your host, Dr. Sanjeev Sriram, and we've been revisiting the arguments about King versus Burwell at the Supreme Court. Now, one of the arguments that came up was when Solicitor General Donald Verrilli, brought up that the possibilities that could ensue if the justices decided to rule in favor of the plaintiffs and stop the subsidies from reaching the federal exchanges. I thought it was actually pretty interesting to hear one of the responses from Justice Scalia, where he actually said that, do we really expect that Congress will do nothing while there are millions of people going without health insurance? In fact, his exact words were, and I'm quoting him right now, "What about Congress? You really think Congress is just going to sit there while all of these disastrous consequences ensue? I mean, how often have we come out with decisions such as the bankruptcy court decision? Congress adjusts, enacts a statute, and that takes care of the problem. It happens all the time. Why is that not going to happen here?" To which Solicitor General Donald Verrilli said, "Well, this Congress, Your Honor," and then there was laughter. It actually is in the Supreme Court transcript as laughter. And then Donald Verrilli continued, I mean, of course, theoretically they could. And Justice Scalia responded, "I don't care what Congress you're talking about. As disastrous as you say, so many million people without insurance and whatnot, yes, I think Congress would act." Well, Justice Scalia, I'd like to approach the bench, and perhaps I don't have the decorum that Solicitor General Donald Verrilli has, but I think we need to really get in touch with reality here. Let's look at this Congress. I moved to D.C. in 2009, and at that time there was about 16% of us Americans who were without health insurance, millions and millions of us. And you know what? Congress did actually just sit there. There was about half of Congress that decided that they were going to just sit there while the rest of us fought for every single vote to get the Affordable Care Act passed. And do I think that this Congress will continue to sit there while millions go without health insurance if the Supreme Court decides to rule in favor of these plaintiffs? Yeah, that's exactly what I expect that they'll do. Because over the last 5 years, Your Honor, none of them have ever proposed a replacement for the Affordable Care Act. There have been almost 60 votes to repeal the darn thing, but nobody has ever once come up with a good replacement plan that would actually ensure that many millions of Americans that the Affordable Care Act has done. Now, I read that Washington Post article written by Senator Brasco and a couple of others saying that they have a replacement plan in the works. It's about, 500, 600 words long, but that's the most that we've ever heard them say in the last 5 years about a replacement for the Affordable Care Act. And to tell you the truth, an op-ed in the Washington Post, that is not the same thing as proposing a bill in a subcommittee, taking that to a committee, then taking that to the floor of the Senate, voting on it, having the House do the similar process, going to conference, and passing a law. That is they are nowhere near close to doing that. And quite frankly, June is going to be coming up pretty fast. We're already at the end of March. We're expecting this ruling to come down from the Supreme Court in June. And even if Justice Alito says that they could delay the ruling to give Congress time to, put something together, they've had 5 years to do that, and they have done nothing. Justice Scalia, this law might not be something that really suits your politics. It might not be the kind of thing that suits the politics of the people who appointed you. It might not suit the politics of the people who are your allies. But the truth of the matter is that this law is saving lives. When we started this fight about 5 years ago, we learned that about 45,000 Americans were losing their lives every year because they lacked affordable health care. Now we're actually turning the tide on that trend. And if we decide that, if you decide to side with these plaintiffs and to make sure that these federal subsidies stop going to the exchanges, we're going to have a major setback here. And we do not have a Congress that really has any kind of backup plan ready to go to save lives and make sure that insurance is still reaching the millions who desperately need it. Your Honor, I think the time is really over for politics. It's time to really look after your fellow Americans, do what's right by them, and make sure that the Affordable Care Act is intact this June so that we can keep moving forward, keep doing the hard work in front of us, and keep our fellow Americans healthy. All right, thanks, you guys. This has been another episode of the Dr. America Show here on the WEAC Radio Network. I've been your host, Dr. Sanjeev Sriram. Next week, we're going to be revisiting what the Affordable Care Act has done in the last 5 years. It's going to be really exciting to celebrate these accomplishments. Hope you guys will be back there to join us. Thank you so much.
You're listening to WEACT Radio, WPWC 1480 AM. Visit us online at weactradio.com.